Guided personalized surgery with ExactechGPS is the latest advancement in technology that provides surgeons with real-time visual guidance in total shoulder replacement surgery. This advanced platform combines surgeon expertise with a computer system to perform your shoulder surgery with a goal of advanced accuracy and precision, personalized to your unique anatomy.
We obtain a CT scan prior to surgery. We use that then to create a 3D model of the shoulder and the scapula. And then we can, on a computer screen, see exactly how we want to put the components into place. And then the neat thing is that you can take that information and while you're doing surgery in the OR, you can use it and we can see in real time how we're putting the components in, and we can match it to what we template prior to surgery.
With a tracker placed on the patient's bone, the system sends data on each patient's anatomical structure and joint movement to the computer. This active tracker technology works together with an infrared camera to monitor the position and alignment of the joint replacement. The computer analyzes the data alongside the 3D model of your bone with calculated key measurements. The surgeon can see important parts of the shoulder anatomy on the display screen that are normally difficult to view during surgery. With this comprehensive visual, your surgeon can verify precisely where to remove damaged bone and place the implant. Personalized for your unique bone structure and anatomy, ExactechGPS gives greater visibility to the shoulder anatomy, allowing for more accurate implant placement.
I think it makes us more consistent in how we get the components in. You're not guessing, you're seeing it firsthand while you're working, and so I think it really makes our results a lot more consistent and accurate. Typically, we'll have them in a sling for about 6 weeks. During that time, physical therapy will work with them 2 to 3 times a week, working on just getting the range of motion back. And then after 6 weeks, the sling comes off. We start letting patients move on their own. Usually around 10 weeks, we'll start some gentle strengthening, and by 3 to 4 months, we're pretty close to done with therapy. Patients can then kind of get back to their normal activities.